I told the ER doctor I couldn't breathe. She said it was anxiety and gave me Ativan. 3 hours later, I was in emergency surgery for a pulmonary embolism that nearly killed me. When I collapsed in my office bathroom, I knew something was seriously wrong. The crushing pain in my chest made it impossible to stand, and each breath felt like inhaling broken glass. My coworker drove me to the ER while I focused on not passing out in her passenger seat, probably just a panic attack. The triage nurse said after I described my symptoms, "Your vitals aren't that bad, not that bad." My heart was racing at 130 beats minus per m in mute, and I couldn't complete a sentence without gasping. But I nodded weakly, too breathless to argue. They placed me in a hallway bed where I waited for 2 hours, watching doctors rush past to treat what they deemed actual emergencies. When the ER doctor finally saw me, she spent less than 3 minutes at my bedside. I tried explaining that I'd never had anxiety before, that this pain started suddenly during a normal workday. I mentioned my birth control pills and recent long flight from Tokyo, parrot factors I'd later learn were significant red flags for blood clots. Classic anxiety presentation, she said, barely looking up from her tablet. Young women your age come in all the time thinking they're dying when it's just stress. But I can't breathe, I whispered. That's the anxiety, she replied confidently. Your oxygen levels are fine. The mind is powerful. Parrot can create very real physical symptoms. She ordered Ativan for anxiety and told me I'd feel better soon. As she turned to leave, I grabbed her arm, tearing something I'd never normally do. Please, I begged. Could you at least do a D-dimer test? It was a blood test for clots I'd read about once in a health magazine. She sighed, visibly annoyed. That's unnecessary, but if it will ease your anxiety, fine. The Ativan made me drowsy but did nothing for the pain. An hour later, a different doctor rushed to my bedside, his face serious. Your damn dimer is extremely elevated. We're taking you for an emergency CT scan. The scan revealed massive blood clots blocking both lungs, a bilateral pulmonary embolism that had likely been growing for days. The new doctor looked genuinely shaken. If you hadn't asked for that specific test, he trailed off, not needing to finish the sentence. Within minutes, I was surrounded by a trauma team. The same nurse who had dismissed me now avoided eye contact as she inserted aisles. The original doctor never returned to my room. During emergency surgery, the surgeon removed clots he later described as the largest I've seen in someone your age. I spent a week in intensive care, learning how close I'd come to death. The hematologist later confirmed I had factor F Leiden, a genetic clotting disorder activated by my birth control pills and the long flight. 6 months later, I received a patient satisfaction survey from the hospital. At the bottom, I wrote, "When women say they can't breathe, believe them the first time." My medical knowledge didn't save my life. Paranoia, my desperation did. I still take blood thinners daily. I still have nightmares about those hours in the hallway fighting to be heard. And I still wonder about other women whose symptoms are dismissed as just anxiety. Parent women who might not know to ask for the specific test that saved my life. Some medical professionals see symptoms. Others see patients. I know which kind I want treating me next time.